Hi guys, this is Jennifer. We're talking about micro cannulas using velour for tear troughs. I am using a Dermasculpt 27 1.5. I also use a 30 1 inch for some patients. What's the difference between a micro cannula versus a blunt tip needle is really going to be safety and the way that this threads. So I'm going to let you zoom way up so you can actually see when I prime this needle, it's going to be coming out the sides just like that. Okay, so we're going to be getting a really safe injection technique without having a sharp tip that could go through those veins in the lower tear trough, infraorbital kind of area. Okay, so stay tuned. I've made sure I've got a really good insertion depth here all the way down to periosteal layer. And then I'm going to pull that out and we're going to go directly into the hole using my micro cannula. And sometimes we have to press just a little bit to get that into the area we want. And then you're going to feel it pop. And then once it does, then we can gently thread it into the area that we want it to go into. All right, sweetheart, you feel that? Mm-hmm. Okay. So now I'm going to feel for my tip and I'm going to pull that tip all the way up to where I need it to go. How you doing?
Pretty good. This isn't bad.
Not horrible, right?
Mm-mm.
Okay. And I've got my tip all the way up to lateral tear trough, which is where I want it to be right now. And then I'm going to start injecting. I am going to still pull back, make sure I'm not in any vessels. I'm going to then put my finger just inside the tear trough here. And then I'm injecting as I pull out. Tell me if you have any increased pain, sweetie.
Nope, everything's good.
And I do a retrograde thread right there. Then I'm going to redirect. A little more filling in this area. Redirect. And sometimes I want to go and add just a little bit more right on top of that. Can you see how that's pulling up? Okay, open your eye for me. Okay. All right, guys, so we stayed at our same insertion point. I pulled out slightly, redirected. Now you can see the tip of my needle is right here. So now I'm just going to do a thin little turn towards the camera there slightly, sweetie. Okay, see right there's my tip. So my needle is now inserted all the way up here, or actually rather my blunt tip cannula. So now we're going to do just a little insertion as I pull out into the hollow there. Beautiful. And one more. Then I'm going to go back up to my tip here. Just a little bit. And then I am done. I'm pulling my needle out. All she's left with is a hole. No bleeding. That hole will be gone by tomorrow. But I want you to look, open your eye for me, Lovey. Look at the difference in the tear troughs. Can you see that?
Oh yeah.
Huge.
Thank you.
Beautiful result. Okay,
Thank
that's
you.
good. Thanks, guys.